You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hi, I'm Zach. I'm really excited to introduce a colleague of mine, Dr. Samantha Vitale. Dr. Samantha graduated from vet school in 2014 from Mississippi State and then on to complete 2 years of internship and 3-year residency in veterinary neurology. Following her residency, she began working as a locum neurologist in a private practice for about 2.5 years before leaving the practice to work full-time as the CEO of Stratocyte. Dr. Samantha is addicted to CrossFit. Ooh, we love CrossFit too. She and her husband have a small hobby farm with 20 chickens, a large vegetable garden, and a golden lab mix named Sally. I have 4 ducks actually.
Oh, you
We
do?
swap for ducks from chickens. Yeah. Samantha, welcome to the show. Thank you for finding the time.
Thank you so much for having me. I want ducks, but we don't have a body of water for them, so I'm trying to hold off.
We don't either. We have a little thing, but the hope was for really healthy eggs that they bring. I like them. I find them more nutritious, but they're bringing them only 3 months a year, so they might have to change into chickens next year. But Samantha, welcome, and so very exciting project. I haven't seen it before. Tell us about Stratocyte, what it is, and let's dive into it.
Yeah, so Stratocyte is a virtual marketplace that allows primary care veterinarians to search for a specialist and book a teleconsult. Myself and my co-founder, Dr. Ashley Mitek, who's an anesthesiologist, we started in 2019 trying to do just teleconsults on our own on the side. And we quickly discovered that we were spending about 10 minutes on a consult and about 30 or 40 minutes on all the administrative tasks associated with that consult, like trying to organize all the records and trying to deal with scheduling and trying to deal with invoicing and all of those things. So we very quickly realized that we were missing something in our industry, which was a platform or a marketplace that took care of all of that for you and allowed the veterinarians to do what they do best, which is just practice veterinary medicine and leave all the boring, tedious administrative tasks to us. So we started developing this platform, and it was a couple year project, but we ended up making what I think is a really great asset to this particular type of teleconsultation. And so basically, it's 100% vet to vet. Both user types, primary care veterinarians and specialists, have to sign up and create an account. And when they do that, we do verify their identity and verify that they are a licensed veterinarian. And then the primary care veterinarian can search for a specialist, find someone that meets their patient's needs, book the appointment through the app, submit all of their patient's records, health history, x-rays, whatever they want through the app, schedule the appointment through it, input the payment information through it. And then if they choose to do a audio or video call, meet with the specialist virtually through the appointment, talk to them, and then the specialist submits a report for their patient's records through the app, and then the case is closed.
This is phenomenal. So I can't tell you how excited I am, because I personally think that the specialty medicine in the way it was when I graduated is dead. It's not available. All our new grads are taught to talk to specialists, but there's no specialists available. So there's no way to connect with them, especially if you need a physical appointment. But I think 90% of it could be actually done remotely. And I am so excited that you're doing that. So I'm actually going to start using it soon. So we'll have to talk after this episode. But tell us more. So one particular aspect, and I don't know if you know about this, but in the past, using SmartFlow, which was a sort of a software product that I built, we were trying to do teleconsulting on anesthesiology, and I was trying to kind of herd the cats of anesthesiologists, which is one of the most rare breeds of this specialists. And so one important thing to know about this difference between telemedicine and teleconsulting, and why it is so much easier to do what you do, and why it's going to really disrupt the specialty medicine.
Yeah, that's a great point. Thank you for asking that question. So the nice thing about teleconsulting is The ABMA guidelines for telemedicine define teleconsulting as basically just a conversational relationship between a veterinary specialist and a primary care veterinarian. So the primary care veterinarian would obviously have to be licensed in their state of practice and would have to have a veterinary client-patient relationship with that patient and client. Because the specialist is only speaking to the veterinarian and they're only providing recommendations to that veterinarian, it's then the primary care veterinarian's responsibility to actually make the medical decisions, to prescribe the treatment, to recommend diagnostics, and to communicate to the client. So it takes away the necessity for the specialist to have a license in the state where the pet lives, as well as a veterinary client-patient relationship.
Yeah, that's so fascinating. And it is a big difference and changes the whole dynamic of the landscape, which I really like. Samantha, one of the things that I wanted to kind of understand or dive a little bit deeper in is like, I understand the minutia and the 20 minutes of paperwork after the 10-minute consult or the 30 minutes of paperwork after the 10-minute consult. Totally understand it. But what have you guys built to really enable that process to be smoother? And how did you go about doing that? You're just sitting around one day and you're like, we should hire some software developers and create some software. Like, that's not a typical thing that happens for a lot of veterinarians.
Yeah. So, we put a lot of thought into how we would want this application to serve us as both a primary care vet and a specialist. And so it's nice because having had, various different practice experiences in our lives, we sort of understood kind of the pain points on both of those ends. And so we wanted to make something that was easy to use, that was kind of like a one-step process. Like if you have ever been very busy and started to do something and then had to stop doing it for a reason, like I don't usually go back and continue the process. And so we wanted to make it kind of just a very straightforward, step-by-step process that they could complete easily on both ends. And so we did do that. We did hire a group of software engineers that specializes in human healthcare development. So it was fun for them because they'd never done a project quite like this. And so once the sign up process is complete, both user types, all they have to do is log into the platform, and then they can access any feature of it. On the specialist side, the specialists work for themselves. They don't work for Stratocyte. We don't tell them what to do. We don't tell them how to do it. We don't tell them how often to do it. We want to make sure that the specialists are completely in control of what they're doing and have the ability to use this to improve their work-life balance, not to worsen it. So they have the opportunity to set their own schedule, which is a feature that's built into the application. They can select the dates and times that they want to be available to receive audio or video call appointments. We have the opportunity for them to set up their own service list. So for example, as a neurologist, I offer like a first-time neurology consultation. I offer a follow-up consultation for the same patient within a year. And the specialist can decide for each of their consultation types that they offer, what modalities they want to offer. They can offer audio calls, which occur through Stratocyte. They can offer video calls, which occur through Stratocyte. And they can offer asynchronous chat, which also occurs through Stratocyte. So that doesn't have a time associated with it. That's just the primary care vet uploads stuff. The specialist looks at it and responds, questions back and forth, communication back and forth. And then when they're done, they send a report. All the medical records and everything are stored securely on our platform. So our doctors don't have to worry about like saving that on their desktop or in a Google Drive or something like that. And then at the end of the appointment, the specialist does submit a summary through Stratocyte so that the primary care vet can access and download that as a PDF for their files.
So I'm so excited. I'm gonna ask 3 questions because I don't want Shawn to interrupt me. So I'll ask 3 right away.
Okay, go ahead.
One, just a list of specialists that now are available through the platform, and if it's not a trade secret, how many are there? So how many specialties, and then how many specialists total? The second question is there an opportunity for real time? Like, for example, if I'm doing a complicated surgery, can I schedule a time with a surgeon and guide me through it instead of having Fossum open in front of me like I used to do in ER? And the third question, what's the fee schedule? You don't necessarily have to say the numbers, but you can if you want, or at least how's it structured? Is it subscription per case or per service style? How does that work?
Yeah, so for your first question, we have 23 specialists on the platform right now. We have a lot of neurologists, just because I am a neurologist, so I know a lot of neurologists. We have 10 neurologists on the platform right now. We have some internists, we have some surgeons, we have some oncologists, we have some cardiologists, we have an ophthalmologist, and we have some anesthesiologists, and we have one behaviorist. So I think that's 8 specialties that we have on the platform right now. Specialists are really excited about this. So it hasn't been terribly difficult to recruit specialists. I've been speaking with some criticalists who have expressed that they are planning to sign up in the very near future. So I'm hoping that we do have some criticalists on board soon. So I've actually slowed down recruiting specialists because we've been doing had a really easy job getting specialists excited about this. As far as the fee structure, each specialist gets to set their own prices. So I can't actually comment or give you numbers because it's entirely up to the specialists themselves. From what I understand, most people are setting pretty reasonable prices compared to what you would expect for the client to pay if they were actually going to go see the specialist in person. So like $100 to $150 for a first time consult. Again, that's entirely up to the specialist. There is no subscription, there's no cost to sign up. So both specialists and primary care vets register for free. You only pay if a consult is completed. If for some reason a primary care vet books a consult and the consult ends up getting canceled for any reason, the primary care vet's card is fully refunded for the entire amount of the appointment. So they don't lose money if the appointment gets canceled for some reason. Oh, real time. Yes, absolutely. So we have a couple surgeons on our platform, and they are very open to doing real time consults, in the OR like that. But yes, you can book virtual video appointments through the app. So you can definitely do real time appointments. Yes.
So cool. So one of the things that has been nagging me since we started the conversation, Samantha, is I'm sure you had a pretty great career lined up, as a specialist, everything was going well. What made you okay with completely changing the trajectory of your career and launching into this world of entrepreneurship where maybe put your house on the line? Like, how did you make this leap to this crazy adventure?
Well, there's a very long answer to that question. I'll try to give you the Reader's Digest version. I think, the most important part of that answer is that I am very, very fortunate to have an extremely supportive husband. And I was in a position where I knew that for me, being a clinical neurologist was not going to be sustainable for my entire life. It was definitely not something that I felt was fulfilling or, going to provide me with the ability to have a joyful, well-rounded life, and that I was going to have to make a change of some sort. And I was very fortunate to have a partner who recognized that and said, well, instead of moving around the country for jobs that aren't going to be fulfilling, why don't you just follow your passion? So that was very helpful. Without him, I don't know that this would be happening. But while I'm glad that I became a neurologist and there was a lot about that career that I really enjoyed and really learned from, I just recognized very early on that was not going to be sustainable for me, and that there was going to have to be another avenue that I can use what I've learned and what I've trained for than just clinical medicine.
Yeah, that makes a ton of sense. So what's the big, bold vision? Where are you taking this thing? Where do you see it being in 5 years from now? Where do you want it?
We want to revolutionize veterinary specialty medicine. We want to make sure that every single pet in the world that wants access to a specialist has access to a specialist. So one of the things that I'm most passionate about, and when we started this, I went to vet school in Mississippi, which is a very rural state. Then I moved to Illinois, and people hear Illinois, they're like, "Oh, I love Chicago." But actually, there's a lot of real estate south of I-80 that's very far from Chicago. There's a lot of rural areas in that state, and there's a lot of people that have to drive 1, 2, 3 hours if they want to take their pet to a specialist. And when I was a resident, I had this patient with seizures, and she came to see me very frequently, and she had a very elderly owners. And they would drive like 3 hours in the snow just to see me for a recheck. And like they ended up being like grandparents to me. I was very close to them. But I just kept thinking, like, we could be doing so much better for these people. Like, why are they risking their lives driving 3 hours in the snow for a seizure recheck? Like, we don't need to do this. And so that's one of the things that I'm extremely passionate about is I want to bring specialty medicine to those people. I want the clients that desperately want to see a specialist, but it's a physical risk for them to go, or it's a financial hardship that they have to take a day off of work, or they don't have childcare, or whatever reason. We can bring that to them. We can bring that right to their local clinic. And so that's the biggest thing, is just being able to bring specialty care to every single pet in the world.
Well, that is a big, bold vision if I ever heard one. Maybe the biggest we've heard on the podcast lately.
That's so awesome. And the one thing that that sometimes is difficult for the veterinarians is to imagine, how do I use this? So let's say when the COVID started, veterinarians said, we're going to start using telemedicine, and then they never did. So can you walk us through how would one use it in their practice? So I see the case, then I sign up on this platform, then I mark up the fees. This is how I generate. Like, can you walk the case like through how would they incorporate it into their daily life? Because that's the most difficult thing when you're developing something new, is to explain to the customer, how would it fit in my day life as a veterinarian? So can you kind of walk us through it?
Yeah, absolutely. So I would say for a primary care or emergency veterinarian that had a case, we'll just use epilepsy as an example, because obviously that's my favorite thing to manage. So if you've got a case of a patient with epilepsy, and it's a young lab, you're pretty confident it's idiopathic epilepsy. Dog's fine in between seizures, 2 years old, doing great. Just had 3 seizures in the past month. The owner comes in and you say, you know what, like I feel pretty comfortable that this dog doesn't need an MRI, doesn't need a spinal tap. Maybe if things escalate down the road, we'll refer for that. But I'd like to manage this case in-house, but I don't love treating epilepsy. So you can offer to the client, like, hey, I can refer you to a neurologist, or we can do a virtual referral. And then if the client wants to do that, you can just go to your desktop, log into stratocyte.com. You can go and search for a neurologist, find one that has appointments available. And let's say you want to book a video appointment. So you can book a video appointment for tomorrow with the neurologist. You can have the client drop that pet off in the morning. So they're there all day. You have the appointment time. You can do a neurologic exam during that video appointment in front of the neurologist if you want. If you don't want to have the dog there, you can just tell the neurologist your findings. Hey, they had a normal neurologic exam, X, Y, and Z, and then talk through treatment recommendations and treatment options for that pet.
So, Samantha, I'm sure we've got lots of listeners that are listening and thinking, oh, wow, this sounds really interesting. How do I find out more information? So how do they find out more information?
Yeah, so you can follow us on Instagram or LinkedIn. Just follow Stratocyte. If you would like to chat with me personally, I'm more than happy to talk to anybody that's interested. I'm more than happy to set up a virtual meeting and help them get signed up. It's a very easy process, but certainly happy to give people a tour of the app and how they can use it. So if people are interested, they can email me at Samantha@stratocyte.com. And then obviously just going to stratocyte.com, people can look around themselves. It's a really easy process to apply. We just ask for your name, your license number, license expiration date, liability insurance, and a picture of your driver's license. One or two other things, but very quick and easy. And so, people can certainly just sign up on their own if they want to check it out for themselves.
That's so awesome. Well, thank you. Thank you for finding the time to connect with us. There's 2 questions we ask at the end. What is the book, video, TED Talk, or something that inspired you recently that you would like to share with the listeners?
The book that I keep reading and rereading is called Hot Seat by Dan Shapiro. Probably not something that just anybody would need to read, but for anybody that is doing a complete career change and trying to do something start a tech startup and do things they have no idea what they're doing is definitely a helpful, easy read and explains it to a veterinarian with no business experience.
Awesome. So last question for you, Samantha, is another innovator that you think we should have on the show.
So I would recommend Dylan Jones, who is the president of Animal Cloud. Animal Cloud is a group of military veterans that started a company that are making wearable devices for military working dogs. They're doing some really amazing things right now with working with our military to help those working dogs that may be in a country where they're in danger or don't have access to veterinary care. And I think it's only a matter of time before we start seeing technology like theirs in our practices and with our own pets. And so they're doing some really great work.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.